slept well. You're getting your day off to a good start, like I am. So I have to go do a drug test. I want to say this is probably like my third drug test for another position. And unfortunately, this particular company, they don't use or have contracts with Concerta or any of the urgent cares. They have their own place, and it's in San Antonio. So when I put it into my computer or GPS, it showed that I had 111 miles. So I am not happy. My appointment is at 9, but I'm not going to make it for that. But I'm still going to go because I'm not going to come back over here. This is like a good over 2 hours drive, and then I have an interview at 1, so I have to get back home and look presentable for that. Woo. But I want to come on. I'm going to go ahead and do the breast lift or my breast surgery over the age of 50. Yeah. So with me, I was pregnant 3 times. I had a spontaneous miscarriage, and then I carried the other 2 full term, even though I tried to get them out before then, because I mean, everybody is different when they're pregnant, but with me, when I got in my latter parts of my pregnancy, I just wanted them out because I could not sleep. I was up all the time. I just wanted them out. I mean, I tried to encourage my doctor to give me a C-section, but he wouldn't. And that's another story. I have to talk about that. But so from those 3 kids, and I used to I ran track, so I was athletic. I'm trying to get back into it, and that's the hard part, is getting back into it. But once I'm into it, man, it's gonna be good, and I'm gonna bring you guys along with me. Let me see if this stuff the sun so much. Yeah, that's better, a little bit better. So before I had kids, I had very, very small breasts. I would consider them like acorns. So like bloop, bloop, chest. You know what I'm saying? So 2 little acorns on each side, then chest everywhere. So technically, it could have been a boy chest. And I loved my little, I loved my acorns. But after I had my kids, my breasts became bigger, but they became saggy. And it was saggy to the point, it's cold, it's hot. They were saggy to the point that when I bent over, they looked like teardrops, like goddamn teardrops. And I hated that. And I would wear bras that were too sizes small, to push them up and make my breasts look like they were full. But once the bra was taken off, that was not the illusion. Now, they weren't flat like you see other people. I had meat in there. It's just they were flat and they were long, and I didn't like it. And depending on what was going on with me, because my weight fluctuates up and down. You know, I see I'm gaining weight, I'll get into the gym, start running, lose the weight. and then, lose some of my breast tissue. But it just decreased the sagging, but it was still there. So I'm gonna say, let's see, 20, so not 2020, 2021, I was looking up for, to have a breast lift. I didn't want to get any implants because there's a lot of risk associated with the implants, as far as they can migrate. Your body just can reject them. You have to spend more money to have them taken out, right? So I decided against that. And so I was looking around, I was for my doctor and so forth. And when I look for my doctor, I like to look at what their pre and what their post weight. What their pre and post pictures look like. I also look up if they had any complaints on them or any deaths on them. Now, is it possible for a doctor to have no deaths? Yes. Is it the likelihood? Slim to none. The problem comes in if they have a steady amount of, then I wouldn't go to them. Not only that, you can look and see if people had complications from that person's procedure. What was their post-op care like? How long did the instructions, how long did it stay down? This, that, and the third. These are everything that you guys, when you're looking for something like that, you need to be looking for and finding that information, because it's going to be crucial in how you make your decision. This is your life, and you don't want to lose your life trying to just fix something you don't like on you, right? So I can tell you on Facebook, they have all these different type of surgery groups. I know if whatever doctor you're going to see, 9 times out of 10, they probably have a surgery group or Instagram. They just will have to add you to their group, so then you can kind of see the before and afters. The other stuff, and you can ask questions in there in the group about just whatever questions you are curious about. But the other stuff, as far as trying to go, you having to look up, if they had any or infection or any of that, that's on you, and that is public knowledge. Just like here, all the things that happen with physicians is public knowledge. You just have to go to that board's website and look it up. So the doctor I decided on was Dr. Disler, and that was short. Let me see WhatsApp was Dr. Disler. So I reached out to her on WhatsApp. This is her, and she reached back out. I told her what I wanted done. I sent her pictures, so she had me send pictures of my breast, in front and side. I bent down, making sure of that. Showed her the back of my back and my stomach. Now you're probably like, why are you showing her your back and your stomach? Because her recommendation, what she and what I wanted to do was to have a breast lift and fat transfer from other parts of your stomach, your back, into your breast. That's what I had done. Not a implant or anything like that. I had transfer. So that's what we discussed. That's what we agreed on. So her first name is Ingrid, Ingrid. And I'm giving you this because to me, she was a very good doctor. Like, she was a very good, she's a very good doctor. And she's one of the few outside of my other doctor who did my tummy tuck, who will tell you the truth, and they're not going to go and do these extreme things when they think it's not going to look right on you. So her first name is Ingrid, her last name is Disler. That's what she goes by, but her last name is actually longer than that. But if you were to look her up on Facebook, you can put Disla Ingrid, and you'll find her. And so I showed her the pictures, right? And then she gave me a price, and then we made an appointment. So I did this in 2021. So it's been a couple of years now. Oh no, look at that back there. It's been a couple of years. So her rates may have gone up, and if they did go up, I don't think they went up by that much. I can pretty much say if your surgeon is a good surgeon, the price range will be about the same, whether it's a tummy tuck, BBL, implants. They're going to be the same, because what they do is when you get a breast implant, a breast lift, they also include liposuction 360 of your abdomen, your love handles, your back. Right? That goes together. She also asks, do you want a BBL? I'm like, no, I don't want a BBL. I already have, earths, and I don't want my earths to be looking dumb and stupid. No, I'm happy with what I have. And she was just saying, well, it goes with the price. You and I get a discount. I'm like, okay, cool, I understand. So we made an appointment. Her price was $5,000 or $5,500. You have other doctors that go do the extreme for those women who want to look like video vixens for whatever reasons, because what they do is pretty hard on your body. But hey, I think they charge between $6,000 and maybe $8,000 or $9,000 for them. But that's if you want that extreme body of a Instagram girl, I guess. I don't know. So the price is $55, right? And that just was her price. That didn't include wait, let me think. So I had to get my own medications, which was basically like not Protonics, it was Prilosec. My own antibiotics, and you could take Prilosec once a day to help with acid reflux. You will have clindamycin, that's an antibiotic. That was taken 4 times a day for 10 days. I had Flagyl. That was taken every 8 hours for 10 days. Then, of course, they had the arnica gel. I have a high pain tolerance, so I had prescriptions for Tylenol 3, but I didn't use them. Then, you have your your post-surgical breast garment that you purchase. And then what else? Oh, and then I just used my old faja because, like I said, she did do liposuction of my abdomen and my back. So I did wear, no I didn't. I bought a faja that had the breast in it. I also purchased some 4x4, some normal saline, some paper tape. I wouldn't do surgical tape. I would do that real thin paper tape, especially if your skin is sensitive, because you're going to have to change, that dressing once or twice a day, or if it gets, saturated. So I did that. What else did I take? I took loose clothes like muumuus, big dresses. And I know I have videos of this. I'm gonna try to find them. I'm gonna really try to put some. I'm not gonna say I'm really going to. I'm gonna put more of an effort in doing my my videos and stuff. Like trying to at least put up a thumbnail as I learn the other things, different ways to shoot and stuff like that. And I hope you guys appreciate that, and I hope you guys just like, comment, and subscribe. I'm still at 5 subscribers, and tell me in the comments what would you like for me to talk about. Tell me if it's, ask me questions. If I'm open to that. But anyway, so I had to be over there, like I had to be over there the same amount of time as when I had my tummy tuck, 7 for 10 days. Now, if you leave before the 10 days, they will not give you an excuse to get on the to get on the airplane. And I've seen that so many times. And I think that is crazy, because I feel like you have money to have the surgery done, but you don't have money to stay really for the aftercare. And that's when things starts happening with these people, or you see these different cases. If you don't have the money to stay over there the whole 10 days, or whatever it is that's suggested by your doctor, I would not go get it. If you don't have the money to get all the essentials and your antibiotics and stuff like that, I would not go get it, because you're playing with your life. Okay? So I stayed at a surgical house and a surgery house, and it was called Home Sweet Home. If I find a video about it of it, because I know I did it. If I find something of her, if I can find something, a video of the surgery house, I will show it to you guys. And when I went, it was low season. So when I got there, it was only, how many? Like 2 people. I was the 3rd person. And no, it was 1 person, right? And then 2 people were coming in the following day. And the person that was there when I got there, she was leaving. So it must have been their low season. So there was a total of 3 people that was there with me. And I left like the day before they left. And so it was cool. They had to fight over no room. They had to be arguing with somebody if you share in a room about TV and stuff like that. So we had that. So The lady felt it's pretty good. Now with me, I let her know prior to me coming, I don't eat beef and I don't eat pork. So if that was going to be an issue, then I couldn't come to her home. Or if she wanted me to like pay a little bit more because of that, then, you know, let me know. But it wasn't an issue. At least until maybe a couple of days in. And it wasn't really an issue. I felt like she wanted me to eat certain things. And if it was something that she cooked, I liked it, I'm like, let's stick with that. But she didn't like that. And I'm sitting here like, and I'm thinking, I'm like, because the things that I like, the few things that she made, let me repeat that. The things I liked everything she made, but it's certain ones that I liked more. But the ones that I liked more cost a little bit more. You know what I'm saying? Like, for instance, spaghetti can go, you can feed a lot of people with spaghetti, right? Get full, easy, all that because of the pasta. That's not what I didn't want. I can't really eat pasta like that. It stays on me now, especially in my older age. Can't do pasta. I can't do any type of breads or anything like that. So that was a small little issue. And then, you know, you have to have your massages. I had them once a day when I was there. And they just felt so good. Now, when I first got off the table, when you first get off the table, your breast's gonna be up here. And you gonna be like, okay. But they gonna drop, okay? They gonna drop. They ain't gonna stay like that. But it was wishful thinking. So I, you know, got my surgery. I had my massage, changed the dressing every day. Okay, so the surgical technique she did was she went up under my arm, and I will show you guys later. And you really can't even see the incision anymore under my arm. That healed pretty well. I didn't keloid there, and really I don't keloid at all. So I guess that's a good thing. But she went up under my arm. She cut off my areolas, and then she did, I guess it's the lollipop method, because it's a surgical incision right up underneath my breast, up to my nipple, and she took, you know, the nipple out. Then she lifted it, put fat in it, and then sutured my nipple back on. That's what she did. So at first I thought I'm not gonna have any feeling to my nipple, but that wasn't the case. I could not lift for the first 2 weeks anything more than 5 pounds, and you know, even lift above my, like, couldn't do that so much. When I went home, I continued not lifting anything heavy because I didn't want to pull a stitch out or by accident, or just mess up the work she had already done. So I say, like, for 4 weeks I was really light duty. I did go back to work. I wasn't pulling on nobody's patience. I did my thing as a nurse, and, you know, that's what I did. Now the crazy thing about it is I went back to work too soon because I was having I was feeling dizzy. So let me go back. Hold on. The other thing that they make you do now, and it's not an option, is they make you purchase 2 units of blood just in case. Now for me, as I explained to them, every time I have any type of surgery, my hemoglobin and hematocrit drops, but my body does a very good job of recovering it. So I, was like, I will pay for it, but I don't want the blood. Like, I don't want the blood. And she was, insistent that if, your blood levels remain low, that, she couldn't in good conscience just, well, you know what? She couldn't in good conscience allow me not to get it, because she really couldn't. She couldn't force me to get it, because that's my right. So I paid for the blood, but I didn't have the blood transfusion. Prior to me going over there, I was taking my iron pills maybe a month or 2 prior, and I was drinking this iron supplement on, let me see if I can find it, on Amazon. It's a liquid, and that stuff is nasty, and if you drink it, you need to make sure you wash your mouth out. Liquid. Let's see what it's called. There it is. It's called, let me make it big. Hold on. Let me make it big. Let's see if y'all can see it. It's called Floridix. Can y'all see that? It's called Floridix. And it works. It works. I didn't have to take the whole bottle. But it works. So that's what I started doing to make sure my hemoglobin and hematocrit was above what it needed to be. I believe her numbers were, your H&H had to be, for me to get my procedure, had to be at 12. I know if I chose to have a BBL, it had to be like at 13. But my numbers were well above 13 because of that drink there. Like I said, it's nasty. Make sure you wash your mouth out, because iron tends to stain your teeth. Don't say I never told you nothing. Okay. So let me fast forward back. I didn't have a surgery. I'm at home. I'm doing my dressing changes on myself. I'm continuing to wear faja and the surgical bra. Surgical bra. Post-op surgical bra. And everything was going well. Now, and I do have a picture, and I'll insert it when I get back home and do the editing, and I'll show you. So it's why it's very, very important to make sure you clean your incisions and change them every day, and not allow, anyone to like touch it. So I'm saying that because I don't want to say it was my left breast, I noticed it was like hot. It was very hot to touch and red, and it was just fiery. And I knew that these are signs and symptoms of infection. And I know my dog had accidentally scratched me, and I'm like, shit, I'm gonna go to the doctor. So what I started doing, this is me, and if what I didn't work for me, then I would have went to the emergency room. So what I started doing is taking an anti-inflammatory, like BC powder, or which is an NSAID, or Aleve. I started taking that like 3 times a day. make sure I clean my incisions a little bit more than the twice a day. And I would put a cold compress on that area for like 2 to 3 minutes, 2 to 3 times a day. Excuse me. And that worked for me. And I made sure I finished taking those antibiotics, and that worked for me. I didn't have to go to the doctor. The redness subsided and went away. I just had to be extra careful with my dog, so she won't be like, and so I healed very, very well. And here it is, 3 years later almost. I'm happy with my results. I have not worn a bra since I've had it done. For what is the purpose? She did an excellent job. She also does other things too. I think she does BBLs too, but I feel like my original doctor, Dr. Medina, is the best when it comes to tummy tuck and lipo 360 and people that want the BBL. I think she's the best because she had made my stomach so flat, like there was no fat in there. I saw my muscles and all I had to do was just work them out. Dr. Disler is known for, what she's known for could have changed, but for me, she was the breast lady. They're like, if you want good breasts, go to her. And so that's what I did. So the sum of everything, you got her fine. Her fee was $5,500. The cost of 2 units of blood was $500. The antibiotics, and I got them here in the States versus over there because I want to believe they're more expensive over there. And then they give you what, I don't know if it's like a knockoff or whatever. So we got that going. Then for the surgical bra, tell these people I'm going, whoa, surgical bra was like maybe $60 a faja. I used my own old faja, so really no money from that. And when I got back to the States from when I had my tummy tuck, the faja that I resonated with that worked for me is the Tributo. With that one, you do have to do your sizes because they make them custom to your size. So for like gauze and normosaline and supplies and tape, I say that's probably like maybe $10. The cost of my surgery house, I was there for 10 days, and in that 10 days, it included all meals and your post-op appointments to your So in the package for the house, it in the package of the house, it also included like one visit to bariatric chamber, which basically helps increase oxygen to your surgical site so you can heal quicker and faster. So that was included. And then the massages, when they came to you to massage, massages were pretty cheap. I want to say they were like $20 per person, $20 per session, and you had to get one every day you were there post-op. So I think I got like 6 or 7. So let's see, the first day I didn't get one. The second day I was in the hospital. So like 7 or 8. No, they were $30. So that was $240. I tipped the girl because the rate that I gave her, or we gave her for that massage, she had to give it to someone else, and they only give her a small percentage of that. And I'm like, that's crazy. And then what am I missing? My flight, of course, if you book ahead of time, it would be between, I think it was like 400 and something for my flight round trip. And then what else? Told you about that. Antibiotics, fluids, my gosh. I did not continue with any type of massages when I returned. I just bought this handheld machine and just kind of massaged around my back with that, and that seemed to help. TED hose, or if you buy them surgical, they can go up to like $20, $30. You can buy them off Amazon for cheaper than that. And that's about it, really. So, oh my God. So when you add everything up, let me take that back. Then also you had to pay the pulmonologist, the cardiologist. So they were $100 a piece for them to clear you. And then you had labs drawn, and that was included in Dr. Disler's price. So I want to say, all in all, I spent about $55, $65, $7,000. We'll go like $8,000 to $8,500 is what I spent. And I did do a little bit of shopping over there, which I'm telling you, to go to DR, don't go shopping, because it's not cheap. It's not cheap to shop over there. When you're looking for clothing and stuff like that, it's expensive. Now that mall is huge and it's beautiful, but it's not something you just want to go over there and spend your money shopping, unless you just don't have nothing better to do. But anyway, when I get home, I will show you as much as possible my surgical incision and how my breasts are sitting. So I am going to continue up this road so I can get this. I have 12 miles left, so I can get situation taken care of, and when I get back home, I'm gonna close out the video. All right, so I will talk to y'all in a minute. Bye. Call you back. All right, you guys, I'm trying to finish out this video, hence you have me right here. I want to kind of show you my scars from when I had my boob lift and fat transfer. So you can tell from the side view, like, they're not hanging anymore, right? And so I'm trying to do this so I don't get demonetized. I should be fine if I do this. Yep. And so you see there, that was the incision there, right? And this is 3 years ago. You can hardly ever see it. Let me do this one, hold on. And on this one, I have to pay attention. You can hardly see it. Yeah. And then what she did, she went up under my arms. You can't even see the scar at all under my arms. I need to find out how to make my armpits lighter. But you can't see how she went up under my arms at all. And 3 years later, they still perky. So my recommendation, if you have saggy breasts and you have some weight on you, I would elect for you to do a fat transfer to your breast and a breast lift. And yes, they do cut you as if they were, well, she had to cut me because she had to lift my breast up. And my areolas, at first I couldn't feel, but I can feel now. I got to go back and put my nipple rings in. But anyway, if you have a little bit of weight on you and your breasts are saggy, I would say opt out and do a breast lift and fat transfer versus getting these implants. Because with the fat transfer, your body is not going to have a reaction to your body. Whereas if you're dealing with outside materials, implants, or whatever, you take the risk of them migrating, your body rejecting it, and then you got to go back and have surgery again. I'm happy with these. I don't plan on going to have surgery again. Everything else, my arms, I'm just going to have to work these out. And that's it. So with that being said, I'm going to end this vlog. Thank you. And I will talk to you guys on another one. Bye. All she does, pacing back and forth. This dog is lost and looking for its mommy. Go to the garage and check, Lassie. Go to the garage. Yeah, you keep doing the same old. Circling, yeah, that ain't gonna help. She's not in the circle. Maybe she's over there. Go look. Like away from Donald Trump. No, it doesn't change. You can read the writing on the wall that he's going to end up check it. Isolated and shamed. Is she over there? More of them may want to just the car's there, but she's not there. I knew you were going to check it. Yeah, no, you smell her, but you don't see her. I get it. Are you going to stop? No, you're going to check the other side of the house? You're going to go to the back door? You don't know what to do with yourself, girl. Your mama did it. Say something, girl. Say something.